Let's continue with the extra points. Shixuan, 10 diffusion, EX upper extremity 11, and Xiyan eyes of the knee, EX lower extremity 5. Location on the tips of the 10 fingers. How to find? These 10 points are located on the tips of the 10 fingers, approximately 0.5 June from the free margin of the fingernail. Located in a comparable position on the foot are the points of EX-LE-12 on the tips of the 10 toes. Needling, prick to bleed. Actions and indication to expel pathogenic factors. These points are used in acute situations when the person is unconscious in cases of wind stroke. It clears heat in febrile disease, summer heat invasion. It extinguishes interior wind in wind stroke, clonic spasm, epilepsy. It opens the orifices and promotes resuscitation in those with loss of consciousness. Shixuan 10 declarations. The point MUE1 were first discussed in the 1,000 Ducat formulas by the great 7th century physician Su Sim Miao. They are almost exclusively used for acute conditions such as loss of consciousness, including the acute phase of wind stroke, epilepsy, heat stroke, sunstroke, etc. They are usually prick to bleed, a procedure this may occasionally be followed by maximization. Eyes of the knee, Xiyan, EX-LE-5. How to find? This point is best located in the patient's knee, flexed, use knee support. The eyes of the knee can be located on the level of the lower border of the patella, lateral and medial to the patellar ligament. The lateral eye of the knee corresponds to stomach 35, the medial eye of the knee to EX-LE-4. Together, these 2 points form the extra point EX-LE-5, Xiyan. Needling, medial eye of the knee, 0.5 to 1 June, vertically or obliquely towards the lateral eye of the knee. Lateral eye of the knee, 0.5 to 1 June, vertically or obliquely towards the medial eye of the knee. Caution, do not needle too deeply to avoid extra articular puncture. These points corresponds to the incision site for knee arthroscopy. Actions, indications, it eliminate wind dampness, reduce swelling, and alleviate pain. Special features, important local points for disorders of the knee. These are important local points of the painful obstruction syndrome of the knees, especially when the pain is in the front of the knee or deep inside the joint. The needle should be inserted obliquely, slightly upwards, and medially towards the center of the joint to a depth of at least 0.25 June. These points give particularly good results if moxa is burned on the needles. It expels wind damp, benefits the knees in swelling and pain of the knee, rigidity of the knee, weakness and numbness of the knee, painful obstruction syndrome, B syndrome of the knee. The Xiyan points were first discussed in the 8th century text, Necessities of a Frontier Official. Lateral Xiyan corresponds to stomach 35, while medial Xiyan is a non-channel point. Used together, these are essential points in the treatment of all knee disorders, whether due to deficiency or excess, heat or cold, or form the basis of any prescription for treating disorders of the knee joint and surrounding tissues.